Professor John, I want to ask you about this Kerala paradox now. You have Kerala with a large vaccine footprint, but new infections are also rising at the same time. Over the last 2 days, Kerala has reported a significant rise in new infections.
Yes, well, I don't want to call it a paradox. There are many reasons why I'm not really surprised the way the spike is happening in Kerala now. I wouldn't actually call it a spike. Actually, it's actually in a plateau. In fact, this was the same situation that Kerala had faced after the first wave. Also, it had a very extended period of almost 1 to 2 months of a plateauing of cases for at around 5,000 cases average for about a two months period. And that's exactly the same thing we're seeing now, of course, except that now it is at a higher plateau compared to the previous plateau that we experienced. And also we need to notice that, this particular wave of the pandemic started in Kerala much later than it started in many other states. For example, by the time Kerala had started seeing surge in cases in this particular wave, there were states like Maharashtra, Madhya Pradesh, Gujarat, UP and many other states which had already started experiencing this surge.
Sure.
So it was almost 1 month later that Kerala actually started this wave. And so I believe, it is also the last to complete. But obviously, I'm not seeing that it is going down completely. It is going to be on a plateau. And it has to be also seen with the fact that Kerala has a lower proportion of the people who are actually having seropositivity as per the third ICMR sero survey. That's the latest we have. And it was only 11% at that time in Kerala population, when it was 21% for the national average. So it means there is a larger percentage of susceptible population out there in Kerala still now. And that is also partly explaining why the cases are still on a plateau and it's not really coming down. And the last 2 days, as you said, this slight increase that you saw is partly a factor of increased testing also. We have seen a rising in tests in the last couple of days, and that is the reason why you also see a higher cases reported in the last couple of days.